Icar-C is a medication that is used to treat or prevent low levels of iron in the blood, which can be caused by conditions like anemia or during pregnancy. It contains ascorbic acid, also known as vitamin C, which helps the body absorb iron from the stomach. It is important to take Icar-C as directed by your doctor and to follow the recommended daily dosage. It is best to take Icar-C at the same time each day for optimal effectiveness. When taking Icar-C, it is best to take it by mouth, usually once daily or as directed by your doctor. It is recommended to take it on an empty stomach, 1 hour before or 2 hours after meals. If you experience stomach upset, you can take it with food, but avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after this medication. Make sure to take Icar-C with a full glass of water, 8 ounces or 240 milliliters, unless your doctor tells you otherwise, and avoid lying down for at least 10 minutes after taking it. If you are using the liquid form of Icar-C, be sure to measure the dose carefully using a special measuring device or spoon. Do not use a household spoon as it may not provide the correct dose. If the liquid form is to be given by dropper, it may be placed well back on the tongue and followed with water or juice. If the liquid form is a suspension, shake the bottle well before each dose. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. If you experience constipation, diarrhea, or upset stomach while taking Icar-C, know that these effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to inform your doctor or pharmacist. You may notice that your stools turn black while taking Icar-C due to the iron in the medication, but this is not harmful. It's important to remember that if your doctor has prescribed Icar-C to you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Icar-C can occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. As always, if you have any concerns about the side effects of Icar-C, don't hesitate to consult your doctor for advice. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years of age. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It's important to keep Icar-C out of reach of children, as an accidental overdose of iron-containing products can be harmful. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. Before taking Icar-C, make sure to inform your doctor or pharmacist if you are allergic to it or have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's important to talk to your pharmacist for more details. Also, inform your doctor or pharmacist about your medical history, especially if you have certain metabolic disorders, alcohol use/abuse, or stomach/intestinal problems. If your iron supplement contains folic acid, be sure to tell your doctor if you have vitamin B12 deficiency before taking it. Before having surgery, inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using Icar-C. It's important to be aware of how Icar-C may interact with other medications. This can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Icar-C can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as much as possible from your doses of Icar-C. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using Icar-C. If someone has taken too much Icar-C and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222 for assistance. In Canada, residents can call their provincial poison control center for help. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important not to share Icar-C with others. While taking this product, you may need to undergo medical tests such as a complete blood count. Make sure to attend all appointments and consult your doctor for more information. There are various iron supplement products available, some of which can be bought without a prescription. Some brands may contain additional ingredients like folic acid or niacin. It's best to consult your doctor or pharmacist for more details. Remember, Icar-C is not a replacement for a balanced diet. It's essential to maintain a well-rounded diet that includes foods rich in iron, such as beans, nuts, asparagus, oatmeal, red meat, dried peaches, and pork liver. And as always, consult your doctor for the recommended daily dosage and the best time to take this medication. If you happen to forget a dose of Icar-C, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one and take the next dose at your regular schedule. Don't take double the dose to make up for the missed one. When it comes to storing Icar-C, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of Icar-C, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.